On the occasion of World Cancer Awareness Day, today I'll give you complete information about cervical cancer. That is, what are the risk factors, symptoms, prevention and cause of cervical cancer. I'm Dr. Megha Panwar, Consultant Obs and Gynae, Medeor Hospital, Qutab Institutional Area. Cervical cancer is the fourth most common cancer among women in India, and it is caused by HPV virus. HPV stands for human papilloma virus, which causes mutation at the DNA level, leading to changes in the cells, ultimately leading to cervical cancer. Now, what are the risk factors of this cancer? There are various risk factors, amongst which are early sexual intercourse, that is sexual intercourse at a very young age, and multiple sexual partner or having a sexual intercourse with someone who has multiple sexual partners also make you prone to this HPV infection, which is the causative factors of among around 90% of the cervical cancer cases. Thirdly is the weakened immune system. That is, if someone is HIV positive or has a weak immune system, is more prone to getting infection, and thus which leads to cancer. Fourthly are birth control pills. The birth control pills, which are also commonly known as oral contraceptive pills, leads to changes in the vaginal flora, which makes the cervix more prone to infections. Fourthly is the sexually transmitted diseases, and fifth factor is the smoking. If the chronic smokers also have a weakened immune system and they are more prone to infection. Now, how you can prevent from this cancer? Firstly, avoid all these risk factors which I have said, and secondly is we are very thankful that now we have a vaccination for cervical cancer, which is known by the name of Gardasil vaccine, and now there is nonavalent vaccine also available. So the Gardasil vaccine should be given to young girls as well as the boys. 9 to 15 years of age, 2 doses are recommended, and above 15 years of age, 3 doses are recommended. Secondly is the pap smear screening. Every woman after 21 years of age should have a pap smear screening every 3 years. And after 30 years of age, the pap smear screening should be combined with a HPV DNA testing, and that can be done at every 5 yearly. So, what is the advantage of pap smear? Actually, this cervical cancer has a very long latent period. That is, from the time of the cervix get infected to the time the cancer get developed, there is a very large duration of time. So the pap smear detects the cervical cancer at the very early stages, at that stage the cancer can be treated by very less or very non-invasive methods, and which can prevent the patient from getting extensive treatment, chemotherapy and radiotherapy. Now I'll talk about symptoms कि आपको कैसे पता चलेगा कि आपको cervical cancer है. तो the red flag signs of the cervical cancer are intermenstrual bleeding, that is bleeding in between the menses, that is whenever the bleeding should not be there. Secondly is the postcoital bleeding, that is bleeding after having a sexual intercourse. Postmenopausal bleeding, that is bleeding after the woman has achieved menopause, and any kind of foul smelling discharge or something like that. So, if you notice any of these signs, visit your nearest gynecologist so that she can get you evaluated for the cervical cancer. Now, how will you make the diagnosis of cancer? The diagnosis is made on the basis of the biopsy or imaging, like the MRI or the CT scan. So the good thing about cervical cancer is if you are active enough and if you do not ignore your symptoms, you can pick it up at a very early stage. At that time, it is easily treatable and non-threatening to life. Thank you so much.